Hello, everybody. I am very excited to be with you today in our virtual room. Hello and welcome. Um, as someone who's attended this event many times in person, I'm sorry we can't be all face to face today, eating the lukewarm hotel food and drinking weak coffee together. Good way of bonding. But I do try to remember the amount of time that we're saving and the amount of carbon we're not emitting by doing this virtually rather than in person. So we can be thankful for that. And I suppose conferences like healthcare are figuring out how to use digital tools to keep us connected. So let's all make the most of it. I'm really excited to be here with these three people, all of whom I'm a great admirer of. This is truly an A-list panel today. Just very briefly, my background for those of you who may not know me. I wear a couple of hats. Years ago, I founded, built and sold a company called TravelSmith that itself went under a dramatic analog to digital transformation. And these days, my passion is around the digital transformation of health, with the eye to how can we use these tools to radically expand access and improve care. I have the aspiration that someday it'll be as easy to get healthcare as it is to find a show on Netflix or grab a car from Uber or order something on Amazon. These days, I wear three hats. I'm a managing director at the Horace W. Goldsmith Foundation, which has done over $500 million in grants, and I oversee all of the work in the healthcare sector there, and recently with a focus almost exclusively on digitization. Secondly, I'm a limited partner and a senior advisor to the RISE Fund, which is a $5 billion plus impact investing platform working in healthcare, education, and many other categories. And last but not least, I'm the founder of Living Goods, which is a social enterprise that works in close partnership, actually with a lot of the people on this panel, but with governments across Africa, and supports over 10,000 community-based health providers who are digitally enabled, are reaching about 8 million people. And this is a platform that's very committed to evidence. It's shown an over 30% impact on child mortality, and is launching this month a plan to expand its reach threefold over the next several years. The hook for this session is obviously the entree is COVID, but the hook for this session is thinking about what some of the opportunities that COVID brings us alongside the manifest challenges. And on that point, as the speakers will share, I just want to emphasize for those of us who are joining from the U.S., the huge disparity in access that we're seeing in COVID to healthcare, and in particular to the vaccine. Whereas where I sit here in Marin County, we're approaching over 90% vaccination rate. Most of the countries that the people on this panel work in, the vaccination rates are well below 10%. So this is the greatest challenge of our time. I like to be an optimist, and I think that this is also one of our greatest opportunities. And there's no better example and proof of that than the tremendous global effort to produce a set of vaccines, which are hugely effective. And one of our panelists, is at an organization that played a pivotal role in the vaccine world. So the question I want to pose to each of these esteemed panelists is to share with us two examples. One, an example of a way that digital transformation in health during COVID has significantly advanced your work, expanded access, improved quality, or advanced the space in some other way. We'll go around once and ask to hear those inspiring stories, and then I'm gonna go around again and ask people to look forward and share their aspiration about what kind of digital transformations they hope will come out of COVID that will be transformative for the places and people they support going forward. So without further ado, let me get started. I'm going to turn first. I should add, through the Goldsmith Foundation, we actually work directly with two of these panelists, LISHA at Last Mile Health and NIKOLAJ at PATH. And so I want to start with LISHA, who I caught up with early this morning. She's just back from West Africa. LISHA is the CEO of Last Mile Health, who many of you know by reputation. So LISHA, if you can give us the short snapshot of Last Mile, and if you can share, an example from the work that you saw on your trip recently, along the lines that we discussed.
Absolutely. Thanks so much, Chuck. It's so great to be here with you and with NIKOLAJ and with JOSÉ. So as Chuck rightly referenced, my name is LISHA McCORMICK. I'm fortunate to serve as the Chief Executive Officer at Last Mile Health. And Chuck, maybe just to kind of go back, Last Mile Health, we exist to save lives in the world's most remote communities, as folks may or may not be familiar. And, I was sharing with JOSÉ and NIKOLAJ as we were sort of preparing for this conversation backstage that I got back from Liberia about 18 hours ago. And as somebody who has sort of split time historically between West Africa and the United States, I had been, I think, like so many of us, grounded because of COVID with less travel, and had been really yearning for a return to greater proximity and community in the work. And I would also say a little bit of a confession in that, I was feeling a little cynical, having been away from the field and having been away from the work for about a year and a half. I was very curious as to what I was going to see when I had a chance to go and be with our leaders and our community members. And Chuck, with such appreciation around sort of this notion of being a pragmatic optimist, I was pretty blown away by what I saw when I had an opportunity to meet both with ministry partners, with our team, with our community health workers that were out in the field, and that have been for the past year and 9 months delivering services on a day-to-day basis. And the work is happening, and it's happening really well. In Liberia in particular, I was extremely impressed with just the platform that the National Community Health Assistant Program has provided in terms of maintaining primary health care during this time of pandemic. And also, I think some of the really important and exceptional work that's happening related to COVID response. And I think to the question that you were asking, Chuck, related to digital enablers and how they are operating not outside of systems, but actually in terms of making systems more congruent and health workers more effective, I would maybe point to two things that really stood out to me. One in particular, Last Mile Health has been partnering with ONA around the development of a digital vaccine tracker. And we initially embarked upon that project with the Ministry of Health of Liberia specifically to facilitate increased targeting, identification, delivery, and sort of continuity in under 5 immunizations. So a lot of things related to child vaccination. And I think what we're actually seeing is that many of those systems and components of those digital tools are in fact going to be highly transferable in terms of the COVID response, and using community health workers as trusted providers that are going to be the ones that are going to be able to help to serve. And as vaccine availability increases, as you rightly said, I think many of the countries where we're all working, we're actually seeing immunization rates of about 4.5% right now. That these community health workers are going to be foundational to delivery of COVID-19 vaccines. So it's something I'm feeling very hopeful for. I think that there are, and I think JOSÉ and NIKOLAJ can speak to this really well as also, fundamentally the best emergency response and the way in which we are going to be able to move through this pandemic is actually by fashioning and utilizing some of the strengthened primary health systems that have already been put in place, specifically, I think, in my mind's eye, related to community health workforce.
Unmute. LISHA, that's fantastic. The vaccine example is a super powerful one, as you and I were chatting this morning. the importance, I mean, the fact that we have a vaccine is a miracle for COVID, or multiple vaccines, and that they're so effective. I think we're almost quickly taken for granted what a huge leap that was. Going forward, of course, vaccines are important on multiple levels. There's the COVID vaccine, which we have to distribute effectively and in a targeted way to the people who need it most. There's the underlying vaccination systems for 0 to 5 children. And now there's a new vaccine coming out for malaria. And so to get the most out of those huge investments, we really need these digital tools to make sure that they're getting quickly to the right people, which is a perfect segue to our next speaker. I've gotten the great pleasure to get to know NIKOLAJ at PATH, who's the CEO of PATH for the last several years. And for those of you who don't know, PATH has been a key partner in the development of the malaria vaccine. So that's a good entree to your work, NIKOLAJ. If you can please also just share with us, PATH is a huge, complex, multi-layered organization, but if you can give us a snapshot with the COVID lens, and then if you can share your 1 or 2 examples of what you're seeing right now in ways that new digital tools are helping meet the moment.
Thank you, Chuck, and it's a great pleasure to meet you all virtually today. And LISHA, I was just reflecting when you start talking about your trip and feeling a little bit jealous about you actually have been out there recently. I was my last trip to the African continent was to DRC in the beginning of March 2020, and I'm saying that because this is an example of what I saw there was an emergency operations center that we had set up to handle the Ebola outbreak that there was currently ongoing in DRC. But when I was there, we were actually transforming that emergency operations center, which is really a digital information hub of tracking an epidemic, into a COVID response hub. And that's just one example of how existing surveillance or digital systems are being pivoted towards more COVID response, and how we can, by being flexible in our approaches and not focus on vertical diseases, actually by using those digital solutions that we have, are able to address the diseases, infectious, but also over time, hopefully also non-infectious diseases, and make those systems play together. This is one of the grand challenges that I think that we have. But back to Seattle, where I am right now, and your question, Chuck. So on OPATH is an organization which maybe some of you are familiar with. We are around 1,500 people around the world, most 900 out of the US and 600 in the US, in multiple countries around the world. And our focus is very much in responding to emerging health threats like this one, responding to pandemics, epidemics, preparing the world for that, and responding as well. Improving lives with science and technology. So Chuck mentioned the malaria vaccine. We have also worked on polio vaccines, Ebola, rotavirus, malaria, the one we just saw last week. We're also working on a COVID vaccine that is easier to distribute across Africa because it's a room temperature stable one. So a lot of work on the innovation and science piece, not only in vaccines, but also diagnostics, medical devices, and digital as well. And then the last thing we are really focusing on now, and even more than before, is the topic of this discussion today, which is the health system capacity and resilience, which is really an area where we need to do much better. We need to do better in all dimensions, but this one is really one, I think, which LISHA also spoke to. How can we help countries build those health systems that are resilient and fit for purpose for this specific country? In terms of an example for where digital has played a part, I really want to turn to the oxygen crisis that you have all read and heard about. Maybe not so much in the US, but around the world. This has been a huge issue, which at first were not part of the global response and focus on vaccine and therapeutics and diagnostics. Oxygen came in later on. And the problem was that there was not really an information system that really captured what was the oxygen capacity around the world, or even specifically in one country. So what we did at PATH was we developed a global, together with technology partners, developed a global dashboard in terms of monitoring oxygen supply, and actually tried to highlight that need and focus and investment that we needed to make sure that this would become part of the response plans. That led to a lot of work in India to help address the oxygen crisis there, but also to get it up on the global agenda by using information, by pulling out this information to show to the world leaders that we need to do more on oxygen. I think I will leave it at that, Chuck, with the example on digital.
Thanks so much. On this panel, the group that I've just gotten to know better more recently is Vital Strategies, which has been a huge force in this space, but not as well known as some of the others, and is working across a very wide range of countries, and in many cases on imperative health needs that don't get as much attention as they do in the mainstream public health world. Jose Luis, if you could share just again a snapshot of Vital Strategies, if such a thing is possible, and then an example of something you're seeing right now in the teeth of the COVID response that you're excited about.
Sure. Thank you, Jacques, and thank you for inviting me to present about Vital Strategies. And we were created out of a dream for a healthier world, and our vision is really a world where everyone is protected by a strong public health system. So we have worked over the past 20 years to help strengthen the health systems, as both NIKOLAJ and LISHA mentioned before, that are so crucial in the countries respond to emerging threats, or even handling the current burden of disease. And for nearly 20 years, this has propelled our organization to work in a variety of issues. We've worked with partners across the world to provide technical assistance on issues from tobacco control, unhealthy food, road crashes, drug overdose, the health effects on climate change, and more recently our response to COVID in 50 countries. Vital Strategies today works in about 70 countries. We support policy change and develop solutions that create health communities. In 2020, public health became the center of more visible in our daily lives. Family members, neighbors, and friends, were exposed to what it is that public health does. But there was an article in the New York Times yesterday about the current crisis in public health in the United States, which illustrates, that despite the pandemic, despite the knowledge about public health, it's under siege and it's underappreciated in terms of that work, and it has led to an exodus of qualified staff from people in the United States. Now, in developing in the country strategies for addressing the pandemic, the public health system's response sometimes become controversial, and I think that leads to the misunderstanding. In the countries where we work, they were severely underfunded and understaffed before the pandemic. And now it's going to be even more difficult and more challenging to build up. But I wanted to share also with you that a lot of the work that we do, even though it's to strengthen the government, involves partners in building partnerships with the civil society, with the academic institutions, with other organizations working on public health. And each one of the initiatives in which Vital Strategies is involved includes those components. During the COVID-19 pandemic, one of the examples that I wanted to highlight is our work on CRVS. That we did. This is the civil registration and vital statistics systems for countries to help, gauge the effects of the pandemic, and to help the governments in their outbreak surveillance and also in the response planning. Vital Strategies developed what we call a technical package for rapid mortality. And I know this is a lot of jargon for the audience, but this helps the countries calculate rapidly, where the mortality causes, and allows them to compare them from this year to the previous year to understand the causes of that mortality, and then to design an intervention to address them. These tools allow the governments to generate daily and weekly counts of the total mortality. And for example, in Peru, our data health team started to work with the government to improve the CRVS system. So when COVID-19 hit, they were much better equipped to measure mortality and better understand the impact almost in real time. Now, Vital Strategy supports 14 countries to generate excess mortality data measurements and to measure the impacts of COVID-19, allowing the governments to be more informed and to know how best to allocate the resources for prevention and treatment.
Public statistics can sound very dry until you realize the power of really understanding what those numbers mean. I remember Jose Luis looking at the excess mortality numbers for New York early in the pandemic, and they were reporting something like 5,000 COVID deaths over a 4-week period. But when you looked at it through the lens that you're using, which is how many more deaths occurred than we would have expected, it was actually twice the number, which means there's this huge blank spot that we're missing in terms of the total toll of the disease. And that's in a country with quite a bit of health technology. Imagine how much excess mortality we're not seeing in countries in sub-Saharan Africa and Asia and elsewhere. This is such a huge, it's such a huge, complicated set of topics to get into in 45 minutes and with 3 very diverse organizations. One theme I will draw out that I think you've each touched on in different ways, and that it's coming up in the chat, is the challenge and the imperative and the challenge of bringing integrated approaches to this. We all know that a lot of public health programs have a history of being funded and run in very siloed fashion, whether that's disease silos or geographic silos. And when you're endeavoring to effectively digitize a country, silos don't work. Certainly, epidemics don't obey silos, and certainly I think one of the participants was asking is, how do we avoid duplication in creating separate systems for tracking mortality or doing surveillance versus systems to strengthen the health systems themselves? I want to go around the room one more time before we get to some of the questions. And as promised, ask each of you to pull out your crystal ball, as it were, and take a little bit of a forward-looking view. We are connected with a group of philanthropists. I want to give you the chance to inspire them. What is something that you're working on right now, LISHA, that you are excited about through this lens of digital transformation that you think has the potential for significantly improving access or outcomes going forward?
Yeah, it's a good question, Chuck. And I think I promise I will come to it. I think just to layer on the good point that you just made, though, around the need for integration and a reduction of redundancy, I think I would call out some of the great work that, Jose and Louise's organization José's organization and NIKOLAJ's organization have done. So with PATH, I think one of the things that's really paramount to focus on is that there's been an enormous amount of thoughtfulness that they've brought to bear around supporting governments to establish strategies that are cohesive and comprehensive, so that it is not something where it's a fragmented approach of everyone sort of mixing and matching the flavor of the day. And I also think, Jose, your team, I think, has been extraordinarily thoughtful about that. And I think that we've seen ways in which there's a conscientiousness around these digital strategies being ones that are both going to enable health workforce, as well as take into account data and metrics and logistics management information systems, which I think we all know is really vitally important when you're actually looking to operationalize a health response and a health program and equip health workers at the end of the day. And that is actually a little bit of a segue, Chuck, to answering your question around things that I'm feeling really, I think, quite excited about and really conscientious that sort of some of the digital tools that are being brought to bear in my mind's eye, I think have enormous opportunity to increase equity. And I think that that is both related to health equity and incorporation of, be it that zero-dose child that is out in a remote rural area that is historically not necessarily been targeted or included in sort of forecasting and plans for delivery of immunization, or be it related to gender equity. I think that that's something that is incredibly important to us at Last Mile Health, very near and dear to my heart. And when I was visiting with our team just the other day, I think one of the things that I was seeing is that many frontline health workers, community health workers, particularly in remote rural areas, we see a huge disparity in terms of women's access to education. And I think that when we're looking at instances where there may be limited primary education, or there's a need to actually send your children away to ensure that they're actually able to receive secondary education, the access gap in terms of education for women is really significant. And if designed well, if designed with a gender mainstreaming lens, I think that we're actually seeing that digital tools are able to upskill a health workforce and better facilitate, particularly women's participation or folks that might actually be coming from a background where they have less historical formal education. And then I think the further wave of the future, and Chuck, I think you and the team at Goldsmith have been so thoughtful about this, is also related to digital tools and where that can actually better facilitate patient self-care and sort of participation in the caregiving process in a way that is extraordinarily patient-centered, that puts the patients a bit more in the driver's seat. And I think we know that particularly for things like reproductive health services, allowing women to actually have a greater say and to be able to tap into some of these digital tools as part of a bundled primary healthcare experience is going to be really important. And I think that that's sort of the next wave. We've worked around community health workforce, and I think community health workforce as a facilitator of some of these digital tools and an enabler of patient experience is really important and really exciting and really profound. Back to you.
Yeah, LISHA, as you know, we're at the foundation, we're huge believers in that second opportunity that you mentioned. I think, in some ways, so many aspects of our lives in the Western countries have been revolutionized by products and services becoming available, at the click of a button, whether that's media, money, retail, what have you. And the sectors that matter to us the most, healthcare and education, seem to have been last to the party of tapping into these opportunities. And my own view, and the thing that we're investing into and looking for opportunities to invest into, are ways to tap into that. My feeling is that maybe the best thing we can do to improve outcomes is just to make it easier for patients to access care. And of course, there's so many ways we can use digital to do that. I think what I worry about is so much of the work in public health tends to focus on providers. How do we strengthen providers? Has to happen. But if you look, look at some of the sectors, I think there is a leapfrog opportunity here to put the patients more at the center of the work. But we'll come back to that. So let me continue around the room here. I'll echo LISHA's point about PATH. One of the things that we're delighted to fund at PATH is PATH's work helping the country of DRC develop a strategic, and to one of the participants' question, integrated approach to digitizing its health sector. Hugely important, hugely challenging. But again, looking forward, NIKOLAJ, is there anything that you're particularly excited about that you want to bring the audience's attention to in this space?
Thanks, Chuck. And there's a lot of, maybe to work in this sector, you have to be an optimist. I think we're all optimists. So I am also excited about, I think, how the discussion is become more nuanced about what is it that makes a health system functional. It is not just now getting the supply out of a COVID vaccine to different places in the world. How do you get those shots into the arms? That's something that is essential, and I know is the focus also for LISHA's organization. But digital, how can we, in that lens, how can digital solutions, information be helpful for community health workers? It's not helpful if they have 15 different applications to manage each individual infectious diseases that they have to support the community with. That's not helpful. They are already living in a stressed environment and underpaid and not with enough resources. So digital needs to be helpful for those people that seek that information and gather that information on behalf of their community, of the region, of the city, whatever it is. But how can we make digital really a facilitator of change and information that is useful for improving health equity? I think that's the big challenge. But it's only one dimension, and that digital goes across. So when I, and this is why I'm optimistic, when I attended the COVID summit recently, it was a very different discussion than it was a year ago. So it was about health workers. There was actually health workers speaking at the summit. There was about they're not getting enough pay, they are not getting enough resources. It was about training, it was about tech transfers, it was about laboratory strengthening, it was about oxygen, it was about disease surveillance. It was not only about money, but it was a talk about all the components that we need to get right to make sure we build back better. So I think the question that came in the chat as well, without the countries and getting them and supporting them, we will not get there. So we need to help countries and acknowledge also there is a tremendous amount of resources and competence in countries to build that bottom up. And I think this is where digital and digital strategies like what we're doing in DRC, how can that strategy actually encompass the whole plan of the Ministry of Health and making them executing whatever, being it on managing immunization or managing COVID or Ebola, how can that plan be integrated or work with countries to make sure that digital is really an enabler of what they want to have and address for their country and their citizens? That's, I think, the future.
The importance of working in partnership across this is, I think everybody would agree firmly. And as a segue to Jose Luis, this is a challenge when you're working with a country. There's a wide range of constituencies. You have a Ministry of Health, you have a Ministry of Technology. You have a whole range of civil society groups, and then the sea of different sources of funding. One thing I really responded to, Jose Luis, in our pre-conversation was how you guys bridge the complex with the simple, and how you try to reduce the complexity and bring solutions that are simple enough that they can really scale, through these government partnerships. And I don't want to lead you too much into your example, but I'd love you to share a little bit about that mindset and how that shapes what you want to do going forward.
Yeah, thank you, Chuck. And as I was listening to NIKOLAJ and explaining this example of how a health worker may have 15 different apps to manage or report to 15 different partners on a particular project, it's already overwhelming for a resource poor setting. If we're going to facilitate the work of our colleagues in the public health system, we have to make it simple. We have to work to simplify the processes. We have to find solutions that are simpler and that help people think creatively. This is why we are in the midst of about to launch a campaign on reimagining public health to simplify the process of collecting data, which is counting and helping people and organizations, community health workers or partner organizations, how to do this effectively, how to train the workers, how to provide them, to support them in their work, and also how to provide them with the tools that help them, get the job done. But I think we have to work hard also on in simplifying regulations and simplifying all of those obstacles that people have. A health worker faces so many choices before they're able to do their job. That it slows down their ability to work effectively. They have to write reports. They have to meet with visitors. They have to deal with with a variety of other issues that have nothing to do sometimes with the work. And a vital strategist, this is part of what we have been looking at the systems. What are those elements that can be shed, those elements that can be removed and simplified the process. It's not easy in governments, as things take time, since whether it's the procurement of medicines or supplies, the distribution, or even keeping the stock of what medicines are available in the systems become extremely complex. But we go back to the fundamental, which is people. And I think that we can have the apps, we can have the technology, but that does not substitute the people and the skills that they bring to get the job done. With work, I think that the community health workers in any aspect of the health system, it's that crucial link between the system and the patient, and I think that's where we should invest in the development of tools that make their job easier, whether it's infection control, patient management, inventory control, etc.
Super. Thank you. I'm watching the clock. We're counting down. We have just a couple of questions that have come in through the chat. LISHA is still with us. She's had a camera problem, but she's still with us. One question, and LISHA, maybe I'll put this one to you, is around collaborating with local organizations.
Yeah.
You see this manifesting in two ways. So it's a good question, Nancy. There are local civil society groups. There's local technology groups. Of course, this is important from both a partnership and engagement point of view, but countries and funders increasingly, want to prioritize building up local partners, so more of the work can take place organically in country. LISHA, I'm going to offer this question to you, but if anybody else wants to share an example or a thought on that, it would be great.
Yeah, I'm happy to chime in on that. And Nancy, it is a really good question. I think For Last Mile Health is an organization that essentially exists to support community health workers and community health workforce, the inherent nature of our work is very deeply tied to community. So, I think that from my vantage point, so much of the work that we've actually done has been around supporting governments to facilitate systems that in some instances are actually implementer agnostic because they have an adequately strong and unified policy, program, curricula, data and measurement tools, means of being able to forecast costing and financing for programming. And I think that we also know that fundamentally, whenever sort of a public sector led sort of approach in programming around some of these health workforce initiatives, it's fundamentally actually like the constituents within that country that are going to need to be able to be empowered to hold government accountable around the services that are being delivered. So, I think that, I hearken back to the fact that in Liberia at this point, we've been able to ensure that 98% of community health workers have actually received the COVID-19 vaccination. And I think that they, in turn, are signaling and saying that this is something that then communities are actually seeing them as trusted providers, where sort of traditional leaders and community activists and civil society organizations are then sort of coming to the table and sort of asking questions around the sanctity of the vaccine, the way in which it's going to be distributed, whether it's going to be done in a fashion that is congruent with what communities and local organizations are actually comfortable with and advocating for. So, and I think to this particular group of funders as well, I would encourage you to ask this question when you are looking at making grants, asking about the way in which, organizations are sort of helping to support and facilitate coalitions that are inclusive of community-based organizations. And then I would also say considering some of your compliance regulations or elements where it might be a little bit more difficult for local organizations to actually be able to meet some of those barriers of entry, and asking the question about whether some of the funding requirements or restrictions that are being put in place actually could be exclusionary to community-based organizations or local groups, would be a really important and radical thing, I think, for the funding community to consider. I hope that's helpful, Chuck. Happy to turn it back to you.
Yeah, thanks. We have just about 2 or 3 minutes to go, and of course, a sea of unanswered questions. One of the participants has asked the question about access to the vaccine. And of course, no one group on this call has the answer to how we're going to get that number from 4% to 70 or 80% goal. But first, I want to give both Jose Luis and NIKOLAJ just a quick chance to offer their perspective on their work around improving access, be that from a targeting lens or from an advocacy lens. What roles are your respective organizations playing in trying to accelerate the equitable, targeted, and speedy distribution of the vaccine? Maybe NIKOLAJ, can I start with you on that one? We got 2 minutes, so give me if you can give us the audience a quick take on it.
It's a big question for 2 minutes.
I know.
But on the access piece, we try to be very loud in terms of speaking out to the inequalities that there is in access right now. So that's on the advocacy piece. We're doing that in all the capitals around the world, aligning with the African CDC and others to make sure that this is really continuing to be raised, because this is not just. On the more supply side, what we are doing is we are actually supporting vaccine manufacturers to increase capacity of the COVID vaccine. We are studying now how you can use fractional doses as well to make sure that there is additional access. We have our own vaccine in development together with institutions in Vietnam, Thailand, and Brazil, which is based on a flu vaccine technology, which means that it is more room temperature stable and can be produced at a much lower price. So hopefully there will be good news of that program soon, so we can get more supply out there. We're helping African and Asian suppliers to ramp up production. So a lot of things. Preparing for how to receive the vaccines and getting countries ready to roll them out, so that when the vaccines arrive, that there is the supply chains that both José Luis and LISHA talked about, ready to receive, and there are community health workers to deliver those shots in the arms and so forth. A lot of things. Yeah.
Unfortunately, I think we are now at time.
Sure.
So forgive me for not managing the end very well. I'm just so grateful for the three of you for participating with us today. I've had the pleasure of working with all of you. And for this audience, I strongly encourage you to get to know the work of these three groups better. And thank you all for participating today.
Thank you very much.
Thank you, Chuck.
Thank you.
José Luis. Thank you, NIKOLAJ. Be well, everyone.
Thanks.